with families, and that's her job to do that. So in terms, Anne, of the specific things for your daughter, that would be that nurse's job, to make sure that everything was working well. So that adds with what Steph said. So the impression that we're all getting is that this is not a blanket way of people, you know, get to stage 5 and this is the way they're treated. For example, everybody is being treated as an individual, and that's really crucial because things can vary so much. So I hope that makes sense as well. I can't remember the nurse's name, but there is the specific nurse's job to do that.
I think I personally found that really reassuring when I heard that actually the fact that this is still a personalised approach, this is still looking at individual cases as individual cases. I think we need to hear that, don't we, as families? I think, yeah, like you, Anne, it's my nightmare too. Okay, so I haven't got any more questions up here. Anyone else want to say anything related to? Kathy's waving at me. Kathy?
No, there is one. Kath Moss put a question.
Oh,
on
yeah, sorry, Kath.
Yep.
So, is this, you did a hospital passport in October? Can we assume this is in the hospital systems? I've done
That's right.
COVID laminated. Yeah.
Shall I go? So, thank you, Kath. It was probably it may well have been a paper version. I'm assume not. And bring it in each time would be at the moment. I think we're in a funny place where we haven't got a good electronic system that we can kind of fit it in a place that's really obvious. So we put it in the electronic notes, and we're trying to do that a lot more now, and means that we can go almost daily for some people and reinsert it as such, so that it's kind of present. I think previously people have come in and then either we've lost them or they've taken them home. So there's a lot of variety there. So no, I'm really sorry to say this, but if you can assume that we don't have sight of it, and to bring it in fresh each time would be equally devastating.
I've laminated the old one and the new COVID one, so hopefully it's ready to go.
Thank you.
Yeah,
that's really helpful.
Thank you for clarifying.
Great. Caroline?
So I should say, if we can give our email address out, the team email address out, Gail and Kathy, so that if you email the passports to us, then that would be great, and then we can make sure that they're on the electronic patient records as well. So that will be fine.
Yeah, it's all on our flyer, Gail. So again, we can make sure at the end of this call that we've sort of made sure all of those resources are with you to put wherever you need to, or send out, or.
Yeah, that's great. That's really helpful. Okay, I'm just checking there's any. Oh, Jessica.
Thank you. I just wanted to say that I had a call this morning, or about an hour ago, from somebody from the Learning Disability South team down in Abingdon. And she was just phoning to check that my daughter was okay. But she also said that she was going to be putting together a hospital passport, the short version of the hospital passport from Imogen's existing hospital passport, and then sending that to you, Steph, I guess.
Yes.
So is that happening generally?
For some people, yes. So the teams are sending us on a daily basis a number of the shortened COVID passports for people that they, and Kirsten, you can probably answer that exactly who, but yes, people they would recognise. It would be quite important that was on, I suppose. Kirsten, do you want to add any more? So I can't see where she is.
Yeah, no, I'm here. So what we've done is we have gone through our people that we support from the Community Learning Disability team, and we're identifying all of our clients with significant health conditions first. But our plan is to make sure that absolutely every single person known to the Learning Disability Services has a shortened COVID-specific passport done in conjunction with families and clients where they have that support. And we have a number of people who are living in supported living who don't. So at those positions, it'll be with the staff teams who support them regularly to understand what the adjustments they need in order to access the best quality care. And we're trying to do that to take the pressure off in the system. But we've also, as I said, linked all of that information onto the internet so that families can do them proactively on their own if they want to. And also it means that anyone who's not open to us has the same ability to access that support and that information.
Okay, thank you. There was a question that I missed earlier, sorry, from Lily Sue. Did you want to ask? I think, Caroline, you wanted to respond to this one, didn't you?
Oh, hi. Yes, Lily is 5. Before the instruction to stay at home, she hit a 38-degree temperature, but has ran temperatures pretty well every day. Today it's 37.2. But actually the GP I consulted just asked me to check to make sure she hadn't got a urine infection, and she doesn't. It's not cloudy. But I've not heard back, and I'm just wondering if I do need to follow this up. She's, you know, very energetic, so periodically she's well, but then she loses energy. So,
Caroline, did you want to come back to that?
okay.
Oh, sorry, I was muted then. I'm sorry. I think if you're worried, please get back in contact with your GP. That's the important thing. So please do that. And out of hours, if you're worried, then 111 is obviously the phone number to phone. But don't leave it. If you're worried, phone your GP and ask to talk through with your GP so that you're reassured for now.
And we need to remember the GPs are still there. They're still doing
Yes, absolutely. Yeah.
Well, and I think we forget we're so
Yes.
wrapped up in this, aren't we? We're forgetting that still other people.
Absolutely.
Yes, the thing, unfortunately, our GP's surgery is closed down completely, so we're linked with the sister surgery, so we don't have access to the doctors that know us. Would you be, I've been leaving it, but would you be unduly concerned that it's ran on for so long, or are we okay just going with it?
I don't know your daughter, so I wouldn't like to be able to say, because I've never met her, but I think if you're worried, and as a mum, if you're worried, then contact the GP. And if you're worried, do it this afternoon, don't wait.
Okay, thank you.
Okay, so if there's no more comments on that one, I'm going to move on to the next question, if that's okay. So we've kind of talked about a few things around if they were in hospital. One of the questions was, is there a way personal assistants and paid carers can be tested at present, as some are going into people's homes? And I think that was something you traced up, Steph, yesterday for us, didn't you?
It was, yes. And the brief answer, and I might just try and find it on the screen, was that no, there isn't at the moment. And I think this is a real sense of sort of frustration and difficulty with that sort of sense of not knowing. And I think that's probably shared by lots of different carers and paid carers and services. So I guess it might be a watch this space, because that might change, but at the moment the answer is no. I think the other thing that I would share with is that where we have had some people tested, they have got a negative result, but actually if their symptoms fit, and the medical team will then take a ruling on their medical knowledge as to whether they feel somebody has it or not. So in some ways I'm seeing that the testing in itself isn't overly helpful, because if you felt that somebody had symptoms, you may get a negative test result, and in which case you would still run with the assumption that they probably had it. And lots of people are getting quite, including people with learning disabilities, are getting mild symptoms. So I think that the short answer was no, but I think go off the symptoms and not necessarily get too hung up on testing at the moment. Hopefully we'll have more testing available soon, but I think that's where we are at the moment.
And there does seem to be quite a bit of pressure on, we hear about this quite often on the news now, aren't we, that there's a lot of pressure about getting support staff and paid staff. So hopefully that will be next on the list. I had somebody else with a hand up. Anne.
Yeah, no, it's me again. I was just kind of wondering, because obviously what happens when you do then get, say, called into hospital or need to go in. My daughter, she gets very high temperatures all of a sudden. So and that's when we usually go into A&E just for probably 2 days kind of visit. But obviously I think a lot of people are holding back because they're worried about what's going to happen if they do go in. So I was just wondering kind of like what they're seeing at the minute, kind of like if you do have a high temper, do you go straight to a COVID assessment? Because obviously, even though Ella's got a history of high temperatures and a reason why medically, I just kind of like want to get it straight in my head. Like if I phone up, say, yeah, going into A&E, I'm not just going to get put to COVID assessment with where there might be people that have got it. Because obviously we've kind of completely isolated. We've not gone to work. We're working from home, and we've not gone out the door.
Yeah, no, good point, actually. I think that from what I've seen at a bit of a distance, to be fair, is that if you were to then present in ED with potential systems, you will be automatically almost sitting within a kind of COVID pathway, in which case you may be in, you know, in those areas. And I think that a lot of people, I'm sure you all at the moment thinking that the hospital is the last place for any reason you'd want to walk down the corridors of in case of picking something up, because obviously we do have a higher proportion of people there with it. It does seem that we have a ambulatory assessment unit, which is being used quite a lot. It's a GP sort of referral, or I presume via 111 as well. So it's a different place to ED that people have sometimes come in, particularly where it's maybe thought to be other things. So if somebody needs an assessment or bloods, scans, that kind of low level. So somebody's not acutely, you know, seriously unwell. And then otherwise, yes, sticking with 111 and GPs to work out what needs to happen and how urgently does somebody need to come in. I would probably suggest to say, I think there's been a little bit more activity with hospital at home. Again, they can come out and do blood tests or make assessments. I know the GPs and maybe in some areas are doing some of that kind of assessment work. And as I say, there's the ambulatory assessment units. There's a few other choices, I think, that can be made to try and avoid the ED, the emergency. And I would agree, you may well then be in contact with others.
Yeah, I mean,
we've been in that environment.
Yeah, we just bypass the GP anyways. Just
okay.
We
just call straight up. Well, you have to go straight up anyway.
Okay, sorry, Anne. I'm going to move you on because there's other people that want to ask questions as well. As I said, we're quite short of time. So, Karen, you asked a question, but actually that was one that was sent to us as well. So, if that's okay, I'll hope this will answer yours. But if it doesn't, then come back to me. So, if a carer needs to go into hospital and they're the only person at home with the child, or if it happens to be a child or an adult, what would happen then? And I guess that could be a question for social care, but if there's anyone wants to answer that from health, who would be happy to answer that? I'm looking at you. You're all going notes.
Okay. Okay, so we're not adult social care, but we'll do our best to give you our picture of what we know is happening in the system, because the system is trying to work really closely together to make sure that we're all able to provide the support. So there's two things really. First off, we know that this is a highly infectious condition. We know that for a lot of people it's mild in symptomology, but we also know that it's unpredictable. So we would advise, as far as possible, everyone to have a think within your care system, because if you are unwell and can't look after your loved one, the most familiarity and the most support we can provide if they are well, and it's you who's poorly, is really important to helping them be least distressed as possible. But where that isn't possible for families, then if we're aware of it, we'll support you through talking through to adult social care or children's social care, and there will always be people who will be available. We will never leave a vulnerable adult or a child at home at risk. So we'll always get into contact to make sure that there is some support put round. But we would ask people to think seriously about doing some crisis planning, so that you've got people that can work with you in your system, and then we can help contact them. As the default position though, we will never leave one of your loved ones alone and vulnerable without care.
Thank you. Does that answer your question as well, Karen?
Yeah, I think so. So I think really what we're looking at is, if possible, you would go to family or friends that could potentially help. And if that really wasn't possible, then you look at social care. I mean, that is what I thought, but you know, I just needed to ask the question.
And I think it's worth, and I know Carers Oxfordshire have been advising the same with the families that they're working with, the carers they're working with, is it's really good to start have a little plan, and to pack a bag and to do all of those things. It is our worst nightmare. It's something we don't want to happen, but to have all that ready and in place before you go, in an emergency, it's one less thing to think about, and then then you can focus on the case in point, can't you?
Yeah.
Okay. So thank you for that. Does anyone else want to follow up on that, Kay or Michelle, about what you're doing at Carers Oxfordshire to support that? I'm looking at you both. You need to unmute if you could.
Sorry. It took me several minutes to unmute.
Yeah.
I think that's absolutely our advice. I think talk to people that are around you. As you plan, make sure the people that you would think could help know, and let them kind of be a part of that planning if you can. I think right now communities are wanting to come around and support each other. So if you have a community around you that you think could help, it's really good to tap into them. But I mean, I'm kind of just want to go along with everybody else, is that nobody's going to be left alone. So try not to worry, but the more you can plan, the better. We do have an outline of a plan that we've kind of been using, and we're just shaping at the moment to make it a bit more emergency based. So if you do want to see that, it's a lot more general, because obviously we support adult carers looking after any adult, but we're really happy to share that with you. And the whole idea is it just gives you a little bit of a guideline or a template to fit what you need to into it. So I'm really happy to share that with Gail, and if it's useful to you, please use it.
Yeah, that's great, thank you. And Karen, you remember doing the Family Champions course, think back to when we did that, write down in 5 minutes what somebody who absolutely doesn't know your child needs to know now.
Yeah,
doing
I
that.
do. Yeah,
An awful lot in 5 minutes.
Indeed.
The most important things about them. Think about like the one-page profiles, all of those sort of things that we've done. Happy to talk people through that, and maybe do a session on that kind of person-centered planning idea if anyone wants us to do that. Okay, I'm going to move us on because we've only got 15 minutes left. Gosh, that's gone quickly, hasn't it? One of the other questions is what's happening with regards to other health issues ongoing with our children, specifically when waiting to hear about surgery or treatments, which have been decided but haven't yet got a start date.
I think at this current time, from what I've seen, and again, Caroline can fill in as well, if I've said something wrong or got gaps, pretty much most things have come to a bit of a stop. Now, so there are a few things that are carrying on, and I think it's about trying to keep in touch with those particular medical teams to work out what's the best options for that individual. So we've had different scenarios and lots of different conversations that I've seen in the last couple of weeks where things possibly were going to go ahead, but actually the risk of people coming into hospital now and the way the services are being realigned to meet the need is meaning that a lot of those things are on hold. But it's really important. We definitely recognise this is going to be an issue. Again, don't sit tight on issues, so try and contact the medical teams. If you need to come to us, and we can try and escalate them to try and work out what the best option might be. So even if we can't do normal treatment, is there something we can do in the meantime? Is there something we can do outside of hospital? So some different things. So, and we'll just need to be ready to try and pick once this is over.
Thank you. If there is, these are the questions we've got for now. If you go away from this meeting and think, I've just thought of another question, please feel free to get in touch with us and feed it through us. We're in regular contact with Steph, and even if it's another question about something else, please use us. I think, Emma, could you mute yourself, please? Thank you. Thank you. Yes, so if you've got any other questions, just send them through to us. If you've been dying to say something and we haven't got in touch, we haven't seen you. Sorry, Caroline, you wanted to say something.
I just wanted to add to what Steph said. So I think I think being realistic, we know that things are really very busy supporting patients with COVID. We know that. So, but if you are worried, please contact us. And what we can then do is, between us and with Kirsten's teams as well, we can work out between us with you what the best course of action is and who we need to be in contact with, and it may be that, you know, your relative's treatment does need to be delayed a bit in terms of what's happening, but it may be that what you're saying is that actually it shows it still needs to go ahead. So please get in contact, and then between Steph and I and Kirsten's team, we will be able to try and help with you to sort out what needs to happen. So, and please don't leave it too late as well. That's the other thing I was going to say.
And I think, sorry, if I could just, I guess in a way of reassuring, we do have a number of people being admitted with non-COVID scenarios. And again, please be reassured, there is other you know, support going on still. Everything else hasn't ground to a halt. So yeah, don't hesitate if there are, you know, issues, then please don't hesitate.
Great, thank you. Okay, so we've got 10 minutes. I'm going to go through, if I'm going to try and share my screen and go through the hospital passport. This is the emergency passport, and it's coming with some top tips, and it's not guidance, it's top tips on how to put it together with some prompts of things that you need to think about. So if I can share this, just bear with me. I will try and get that up. I've got so many things up on my screen. There we go. Let's see if this is coming up. Okay, can we see that? I'm trying to move it up. Okay, can everyone see that? Yeah, good. Okay, so this is the grab and go guide.
Yes.
Which I think is a kind of NHS terminology, if I'm right about that, Steph. I don't know, it's their idea. They're doing quite a lot of these grab and go guides apparently, and this is one that very clearly we wanted it to state that the NHS have approved it, and that it says right at the top, I have a learning disability or I'm autistic. And it also says really clearly about the Human Rights Act, and that this should be protected. The NHS must protect and respect my human rights in making decisions. There's decisions about treatment should be made on an individual basis and in consultation with families, taking into account my usual health. All the things Steph and Caroline have been saying, that is right there at the top of this passport. I think this is about the 5th version, and I'm not sure this is the final one. So I'm not going to send this out. I'm going to send the approved version out to everyone once it's got the information. It just also talks about all decisions must be made in accordance with the principles of the Mental Capacity Act. So all of those things that have been there, things like reasonable adjustments, all those things are still going to be taken into consideration. That does not go out of the window. The reason that this is being put together is because they're going to be very busy in these wards, and this is something they can just look at straight away. So it's got that key information. It talks about the name, what they like to be called, NHS number, because that's key as well, next of kin, phone number. I won't go through all of it, but it literally says all the things that you need to have on there. So existing medications, what I need help with, how I communicate, and that's a key bit. I'm not sure I've even pulled up the most recent one here. Oh, that's right. This is how I know, this is how people know if I'm in pain. This is what I might be like when I'm worried or upset. This is how I communicate. Talks about the basic kind of communication. There's not a huge amount of space on this. But what the latest version also says, you know, please make sure you refer to my full hospital passport. If you haven't got a hospital passport and you would like some help to put one together, and maybe we could do another session like this. But we can send you some links where you can learn how to do them. And now I can't get back onto my full screen. There we go. Okay. Sorry, bear with me. I'm trying to get out of share screen. There we go. Stop sharing. There we go. There. Got there eventually. Could you all see that okay? As I say, once I've got the final version, I will send that out, and I'm sure it'll be coming at you from all quarters, which is great. But it's been really good to be able to get that done. And as I say, alongside that, there will also be those top tips, and we'll send that when we send out the final passport for people. One of the key things, the key bits of information in that is that it's laminated, and it should be laminated twice if you can get it laminated. If you don't have a laminator, I know lots of us parents do because we've had to laminate things over the years, but if you don't have a laminator, then in a plastic bag, it needs to be washable. It can't just be a piece of paper. But as I say, there's lots of other tips on there as well. Okay, I'm still getting some questions. I'm not sure we're going to have time to go through all of them. One question is, will there be a different one for physically disabled, or should you use this one for a non-verbal child with cerebral palsy? I don't see any reason why you couldn't. I'm going to actually, Steph, do you want to answer that?
Yeah, at the end of the day, these are just tools. So do what you like with it. If you need to take off learning disability and, you know, write big letters, physical disability, or if you want to use something that looks different, it doesn't matter. At the end of the day, this is a tool to help bring in the information that you need. So equally, if you have something else that's short, brief, and is already done, and you feel says what you wanted to do, that's fine. So don't feel bound by the wording. It is just paper and words, and make it fit for what you need it to do.
Yeah. That's good advice. Make it personal. Okay, so we've got the last sort of 5 minutes of this. We are going to try and have other events like this online. This is the way forward at the moment. If you have any suggestions, I'm talking to social care at the moment to see if I can get someone from adult social care and hopefully children's social care as well to come on. And do the same as Steph and Caroline and Kirsten have done today. So if you've got any sort of burning questions or burning ideas that you want us to run on a particular issue, then just get in touch and we'll try and put them on. As I say, we'll be in touch. You're all on our database. Actually, Kathy, did you want to say something about people's emails and getting in touch? Permissions and things.
Yeah, so what we're going to do after this is, because you know, there's a lot of information that's been discussed, so this has been recorded. I'll take I'll summarize what's being said in response to the questions, and that will be coming out to everybody. We've had a few new people sign up today that actually are on our mailing list with OxFSN, and I know GDPR seems like the least thing that we need to be worried about right now, but if you are new, if you don't want to receive anything from us, could you just email me? I think you've all got my email, and let me know. Otherwise, I'll just assume that you're happy to receive information from us. But we're going to be doing a summary of what's been discussed today, so that people have it kind of written down, because I know sometimes that's quite nice and handy to have as well.
And as Kathy said, you know, we have been recording this. I have to say we haven't recorded all of it, Kathy, because I didn't press the record button at the beginning, but then I remember.
Behind you.
that is mainly for our purposes. We're not going to be showing it everywhere. So don't worry if you're on screen or whatever. It's for us to take minutes from, well, half of them now, obviously, because I've only done half of it. I'll get better.
I didn't take notes, so I hope I remember what you said.
I didn't. It's fine. Caroline.
Thanks, Gail. There was a really interesting question about court of protection and lasting power of attorney. So I wonder whether it is possible to add on into the absolute final version of the COVID passport about power of attorney, and because the clinicians would need to see those documents. That's really important.
Okay, I'm not sure that's gonna. I'm not sure it's going to be done now. I think it literally is. They're signing.
Okay, all right. Okay.
But it's like we say, it's been done so quickly. It's a kind of
no, it's fine. Absolutely,
it's better than what we've had.
Oh no, yeah.
But
no,
no, you're right. It's an important point actually. If somebody has got that, then that's great.
No worries.
Okay, so as I said, next steps, we are going to plan more of these. Do let us know what you think, good or bad. Be kind though, because like I said, it is the first time we've done it with so many. I'm quite glad we didn't get the full 50 people on actually, because I think it was enough with nearly 30. So yes, and Kathy's going to send out, Kathy will send out some of the questions and answers. If there's anything else, please get in touch. I just wondered whether Michelle or Kay wanted to say a little bit about what you're doing locally as well. We've got lots of information on our website, as have Oxford Health, as have lots of other people. There's loads of resources out there. We're trying not to bombard people, but there is lots of information out there. We will keep putting that on. Anything that we feel is relevant or important for people with learning disabilities, we'll continue to share. We are still around in our homes, obviously, but we're still here. If you're struggling, or if you know anyone that's struggling, do get in touch. If you've got any questions about anything, do get in touch, and we will try and find out. We're quite linked in now to some key people. So Kay, did you want to just say something about what you're providing at the moment as well?
Very similar, in fact. I mean, we're kind of almost saying that we'd like to think we're nearly business as usual. Obviously, we're not doing face-to-face one-to-ones, but anybody can call up. We're actually calling around all the people that we know, that we see in groups, to actually try and make sure everybody still has a voice and is able to be in contact. And I would say the same thing. I think if anybody has any issues, feels they need supporting, we're absolutely there to continue that kind of service. It's great to be part of this, and it's been great to be part of this with Gail and with the guys at OUH. And we are planning to do another one that we said earlier, which may be with a wider outlook for carers. But if anybody wants to join that, or has some questions that they want to say, you know, don't feel that you can't come along to that as well. This is something, if you have a question or a problem as a carer, you know, we're all there to help you right now in this kind of really strange place that we find ourselves in.
Great, thank you. Okay, so we are now at that dead on time. Look at that. Nothing if not a good timekeeper. Kathy, I just want to thank Kathy as well, because Kathy's done all the work kind of setting up the Eventbrite and everything. And again, thank you, Steph, Kirsten, and Caroline, for coming on and answering the questions. We're getting some comments from people saying it's been really helpful, really excellent to have the professionals give their time today. So I just think I think you've put some people's mind at rest, hopefully a lot of people's mind at rest. And thank you very much, and see you next time. Thank you. Bye.